So good morning and welcome. Today we are going to have a live chat with Dave, my friend here and colleague. It is about stomas. First Saturday of October every year is considered as the International Ostomy Day. What is a stoma? The stoma is when part of our tubular organ, which is a hollow tubular organ, is brought out to the skin. Now this can be brought out with a tube, or it can be brought out by stitching that organ to the skin. And I'll give you a few examples of it. When the windpipe or the trachea is brought out to the skin, it's called a tracheostomy. When the tube is placed into the stomach for various reasons, for feeding, for draining the stomach, etc., when people can't eat or swallow normally, it's called a gastrostomy. When the upper part of the small intestine, a tube is placed into it or it's brought out to the skin, it's called a jejunostomy. And a lower part of the small intestine, ileostomy, and similarly part of the colon is brought out, is called a colostomy. When the tubes from the kidneys are brought out, it's called a ureterostomy or an ileal conduit. So there are many different types of stomas. And this day is in recognition of millions of people who live with these stomas. We are lucky here today that I have got Dave here who has lived with a stoma for the past 20 odd years. And he is very happy to share his experience with the stoma, his life before the stoma and his life since. He has been through the mills with the complications of stomas as well. So he will share his experience with us today, and we are very lucky to share this on different platforms of social media. If you have any questions, then please do write them in the comment section on my YouTube channel. I'll be very happy to answer those questions from the medical perspective. If you have any questions from the patient's perspective, please again leave them in the comment section and I'll ask Dave to answer those questions. Good morning, how are you?
Fine, thank you.
And I'm very grateful for you to coming over today.
It's my pleasure.
It's a bit overcast, but lovely place to sit. It's
very nice.
Yeah, very nice today.
today.
So, Dave, the first question that I have from you is, what type of stoma do you have?
I have an ileostomy.
And why did you need this stoma in the first place?
I was diagnosed with Crohn's disease in 1985. It got progressively worse over the years, and in 2001 I had my first stoma, first of five.
First of five, okay.
First of five.
And so we'll go through that in a second. Knowing about the stoma before and actually having a stoma on the tummy or waking up from a general anesthetic, coming around after a few hours and following day or that evening whenever you had the operation, for the first time living with the reality that now you have a bag on the tummy, not knowing what will happen to that bag, how you're going to handle it, will you be able to handle it or not, whether your family will be able to handle it or not. How did you feel? Do you remember 20 years ago how you felt?
Very well indeed. I remember for the first couple of times that the bag was changed, I couldn't even look, and I couldn't even look at the stoma. And then one day I was laying in bed and I just thought to myself, you've got to get on with this, this is your life now. I made the conscious effort to get out to the toilet, change the bag, look at the stoma. And I just thought to myself, you've got to carry on, which is what I did. And from then on, it wasn't a problem. I knew it was part of me, and that was the way things were going to be. But initially, no, I can't say that it was something I relished. But then, as I say, I became quite hardened to it and learnt what I needed to do to look after the stoma, to change the bags, and not let the nurses do it as I had been.
So Dave, when you were first diagnosed in 1985 and your stoma or your first stoma came in 2001, that's a gap of about 16 odd years.
That's correct.
So what was your quality of life in those 16 years or even before you were diagnosed with Crohn's disease?
Initially, it started okay. I wasn't really sure what it was, read up on it somewhat, but then it declined over the years, and it was agony till I couldn't eat a meal, couldn't ever finish a meal. Some nights I'd literally be laying on the floor rolling around in agony, screaming in pain. It was dreadful. Crohn's disease is a dreadful illness, and I actually welcomed the opportunity to have the stoma in 2001. I think we got to such a stage where the options weren't anything but having a stoma.
So when you say you were rolling in pain, was it just pain, or is it you were going to the toilet more often, like many people with Crohn's do?
I was going to the toilet probably up to 30 times a day.
Oh wow! So
Which-
you couldn't leave the house, or
Literally. No, that's true.
were you able to work during that time, or you couldn't go to work?
Sporadically. I didn't work for a year, but the medication that I was actually put on by the London hospital did help, but my attendance wasn't great within that period of the time that I was actually working for another firm. Obviously, being so ill, you could never guarantee whether you're going to go into work one day to the next. So I had quite an understanding employer at that time, who did look after me quite well.
Stoma, in my view, is a life-changing procedure. It's a life-preserving procedure.
Very much so.
Not just to improve the quality of life for an individual, like in your case, it was dramatic improvement of life, because your life was literally housebound. So it sounded like you were going to the toilet twice every hour, and that is no quality of life.
Mm.
However, many stomas are made to preserve life, because without a stoma, surgeon hasn't got a choice to save patient's life. The next thing I'd like to ask is, was your stoma performed as an emergency procedure, or was it performed as an elective, which means you had a few weeks to think about it and you were given information about the stoma and you got the chance to see the stoma nurses before, because many patients who have elective stomas do see the stoma nurses before they show you what the bags look like and give you as much information as they possibly can.
That's exactly what happened. I had a gentleman come to my house to explain, who actually had a stoma himself.
Alright.
He came around with his wife, answered any questions. The two stoma nurses at Basildon Hospital were wonderful, and they guided me through from start before the operation to once I'd had the operation and gone home. They'd come around every day, look after me. I can't speak highly enough of them. Yes, I had time to think about things, but really there wasn't a great deal to think about because my quality of life was so bad. I just welcomed the opportunity to have the operation, and it did give me a completely new lease of life.
So talking to you earlier, we know you had several operations for your Crohn's disease. So do you remember when you had the first stoma that was given to you, was any part of the bowel removed, and which part of your bowel was involved in Crohn's disease?
I had the Crohn's was present in the lower bowel, and I went in for a permanent stoma.
Right.
But there was enough that the surgeons could save to, and they didn't feel that the bowel was diseased enough to remove the whole colon at that particular time. So although I did go in for a permanent stoma, when I came around, the doctor did say to me, there is a chance that we can do a reversal. We've managed to save enough bowel for that to happen, and they wanted to monitor it from there, which did actually occur 2 years on.
So after your first surgery, when you had the first stoma, how was your quality of life?
After the first surgery?
Yeah, as compared to what it was before the first operation.
There was a lot of problems with leaks initially.
Yeah.
That was difficult. That was more I think the most mentally challenging part was the first stoma, because I had to come to terms with it wasn't a fact of that it was a body changing thing so much, but finding the right appliances was very difficult for the first stoma. I tried numerous appliances that didn't work, and that was quite upsetting at times.
What was the impact of your stoma and you as a person? Because obviously it is a big thing to go through. affects you mentally, it affects you physically, and obviously someone has to live with that person who might not be the same person for a short period of time or a long period of time when they first went to the hospital. And also living with a bag, somebody around you with a bag can leak, while you're watching telly or having dinner, etc. How did your family take it?
My wife throughout all this has been my rock. I don't think I would have ever been able to get through it without such a great family. She embraced it, literally read up on it and learned everything that she needed to know to help me. It was difficult times with a young child. My daughter was quite young at that point, and she's seen me be ill quite a lot. So I think it's probably had a bit of an effect on her over the years, seeing her dad being ill quite a fair bit. I've asked her that now. I mean, she's 28 now, but yeah, I think that left bad memories for her.
So Dave, you said earlier, and that's a great thing to share, because not many people know that how difficult life can be with the stomas. And from doctor's point of view as well, it can be quite challenging for surgeons as well, because stomas are, especially stoma complications, are very difficult to deal with.
I see.
Because the reason why stoma is made is to deal with a problem, and when that solution goes wrong, then how do you deal with the solution which has gone wrong? So it can be a big challenge. So your first stoma, 2001, then I presume it was reversed at some stage?
It was reversed, yes, which didn't work out well for me.
And at that time, it didn't work out because your Crohn's went out of control again?
Yes, it was, the Crohn's did come back, yes.
Okay. And did you have any treatment for Crohn's at the time?
I did, yes.
You had infliximab, etc.?
It was infliximab at one point,
infusions
yes.
as well.
Yes.
So at that time, that was, state-of-the-art treatment, but it did not manage to control your Crohn's.
It made me feel well for a while, but I also had the added complication of pyoderma gangrenosum.
Oh, did you? Okay.
Which is very painful.
And then, when did you had the stoma put on again?
2 years after.
2 years after.
The second stoma I had when the stoma actually was put in place. After that, unfortunately, I developed a really bad hernia.
Was the hernia around the stoma, or was it around your scar?
It was around the stoma.
Okay. And was it repaired, or the stoma was refashioned somewhere?
Yes, it was repaired, and I had to have the stoma once again.
Did you have more bowel removed afterwards as well?
Yes, there was more bowel removed, yes.
And do you have any colon at the moment at all? Or
no, I've got total colectomy now.
You had, and you got an ileostomy.
Yes.
And is it on the left side or the right side?
Presently on the right side.
On the right side, okay.
I've had them on both sides.
Sure. And do you still require treatment for Crohn's disease?
I go to St Mark's Hospital once a year now.
You do, okay. Great hospital.
Excellent hospital.
Excellent
Can't speak highly enough of them.
And do you still require any medical treatment for it or not?
I still take a very small amount of steroids.
So David, if I ask you that what is your quality of life now after 5 operations, going through all the complications that can happen after a stoma, you had a hernia, you had adhesions, you had surgery for it, resiting of the stoma, you had part of the bowel removed and the whole bowel removed, so you've gone through the mills. And in my experience, not many patients go through so many operations with the stoma. Crohn's is a unique disease, which is a really complicated disease, and a disease which has got higher complications as compared to others. So I presume in your case, Crohn's was a major influence in your complications. However, if I ask you now, before 2001, 16, 17 odd years, when you were having symptoms of Crohn's, and not after the first operation because you went through hell and back after the first few years, now your quality of life for the past few years since your last operation, which was about 2 years ago?
4 years ago.
4 years ago. 4 years ago, sorry. So, how will you compare your quality of life now, and what is your routine now?
I'd say my quality of life compared to then is like night and day. I look back now. It's hard to even remember the bad times to a great extent. I live a normal life now, and which is something I never thought that I'd be able to do at one point.
So take me through your routine. What do you do when you get up in the morning with your stoma, and what do you do during the day?
So I would get up in the morning, take the stoma bag off, clean the stoma, then get into the shower, clean myself,
Yeah.
get out straight away, dry the stoma, make sure that everything is fine, put a new clean bag on, then dry myself off, get dressed, then literally have breakfast. I'm a bit careful about what I eat still.
Right.
You still have to be, shall we say, rather choosy with your diet. I know there's certain things if I eat, I will pay the price for that. So I tend to, even though certain things that I quite like, I would avoid nonetheless. Yeah, as I say, my life has improved so much, completely out of hand compared to where I was pre-stoma, pre-2001. And I thank everybody that's been involved in getting me back to this particular point, because it has been a hard road.
So do you think if we ignore about your stoma, that maybe you don't have a stoma, your life is like a normal person's life?
I think so, yes.
Okay, good. So you can go to the pub, you can go to restaurant normally, etc., etc.
I have to be careful about what I eat, as
Yeah.
I say, you know, I do feel that if I'm going out, as in coming here this morning, I wouldn't eat, because obviously I don't really want the bag to be filling up and having to empty it in opportune moments, if you like.
So if you're going out, say, on a long journey or something, in a car, or say if you're going out for a day out to somewhere, to someone's house, do you take a spare bag with you? Or
Always.
Always do.
Always carry supplies. Never be caught out.
So you have a bag in which all the necessary
Yes,
stuff is
in
there
the
all
car.
the time. Okay. So if I ask you to say, in your own words, what will your message be to people who are undergoing stomas, recently have had stomas, not used to having stomas, or people who have been told, that patients who have been told that they might require a stoma? What will your message be to them?
I think everybody goes into having a stoma with a great deal of trepidation. I think sometimes you're actually forced into the situation by your own personal circumstances, but I would say always listen and take medical advice, because I don't think that the operation would take place if you didn't need it. Having a bag isn't the worst thing that's ever going to happen to you, and it will only improve your life.
I think that is a very good message, that we should leave our treatment in the hands of the professionals. And there's lots of support available out there when it wasn't maybe 30, 40 years ago. Obviously, the main reason of doing this video is to increase the awareness of people with stomas. But that is the most important thing, that, you know, people are out there and they sometimes require support, sometimes requires help. And we should be able to provide that support and help. So, thank you so much indeed.
It's my pleasure. Thank you very much indeed.
Thank you very much.